Hey moms and dads, I'm here with Mo.
Hi.
She is a dental hygienist and mom of a really adorable 5-year-old who is back to kindergarten in September. She is here to give us all her tips on teeth care for your school-age kids. I specifically really need those tips because my daughter, who is also 5, just had her first set of x-rays done and they found 5 cavities. So I'm basically feeling like a huge failure at the moment, and like we totally bombed our teeth care routine. So Mo is here to help me feel better about it and tell me I'm not alone, and then also get us back on track. By the way, we're Mabel's Labels. We make name labels for all your kids' gear, but more than that, we are also a space to talk about all things parenthood. So subscribe to our channel so you can hear all the tips, stories, and get a first look at our sales. And also, if you want to send a comment below, and if you have any questions for Mo, I'm sure she will get back to me to get back to you.
Yeah.
Or if you have similar experiences, just chat in the comments below. We'd love to hear about it.
I will comment back. Yeah.
Perfect. Yes, because you are on YouTube as well,
Yeah.
so that's perfect. All right, so let's talk about this.
Yeah.
Let's break this down. I showed up, they did the x-rays, 5 cavities.
Mm-hmm.
Do you see this a lot?
I do.
Okay.
Yeah. You're not the only one.
I'm not alone?
It's, as a mother, you feel like, oh my gosh, but it does happen.
Okay, this makes me feel better. So
Yeah.
what do you tell parents after that? Because I'm sure they kind of freak out a little.
It depends on where the cavity is.
Okay.
So I can't really, it's hard to say.
There's not like a one fit
There's
answer.
not, exactly.
Okay.
So if the cavities were in a place where, like in between the teeth,
Yes.
then we talk about flossing. If
Okay.
it was on top of like the biting surfaces, we talk about brushing. Like,
Okay.
so it depends.
Okay.
Yeah.
So what is like that ideal routine to have with your kids? Like what do you tell parents in terms of just general teeth care, oral care routines that they should have at home?
So at home, it's the same as adults, like what we would say for adults. So you want to brush 2 times a day, and you want it to be for at least 2 minutes.
Okay.
Okay, so and I like to do a time 2 minutes. So if you put on a timer on your phone, or even like a song that goes on for 2 minutes, brush for that long. And then always you want to have the parent to go back in and check. Because kids are not, like, up until you're 12, kids are not going to brush perfectly. Like, even adults, we don't
So
brush.
what am I checking? So I let her brush for 2 minutes?
Yes.
Okay, and then what am I checking for when I go back?
For plaque. Like, plaque is really, like, you'll see, like, white, sticky, like, I don't know how to explain it, but it's...
Like, kind of that... I know what you mean. Okay,
yeah. So you're looking for that, and if you see that, then just go back in.
So you're looking for, like, a smooth tooth. So what about, like, way back?
You gotta
probably just good to give it a go anyway, just to be good.
Yeah.
Okay, cool. Because I was gonna ask you like, who does all the brushing?
Mm-hmm.
So now, is there like, do we need to be super thorough both times, or can we kind of be like super thorough at night and then let her kind of do her thing in the morning, or what? Be
That's a
real,
good
because
question.
like mornings are crazy, and I just
That's a good question. Yeah.
I don't want to get in. Like, I don't want to add that.
Yeah. No, that's actually a really good question. So, like. At nighttime, that's when you're asleep, your mouth has less saliva in it. So you're more susceptible to getting cavities at night.
Oh.
So the one time that I'm like, if you're not, like, some people don't want to brush. And I'm like, if you're not going to brush, can you please just brush at night?
Okay.
Because that'll, like, your mouth is way more susceptible.
So the nighttime brushing is the more important one.
Yes.
That's really, really good to know. So then in the morning, you're just sort of...
You can do like
a little...
Yeah.
Just whatever you missed from the night kind of thing? Okay.
Yeah. If your schedule doesn't allow it, nighttime should be the one.
To focus on. Cool. What are we brushing with? So, I mean, obviously toothbrush.
Yeah.
I don't know what all the options are nowadays, but what kind of toothbrush do you recommend for families?
So I recommend power toothbrush. So just like this one, yep, right here, a power brush. They do way more strokes per minute than you could with your mouth anyway. I mean, with your hand anyway.
Yeah.
So I definitely recommend power.
Okay, good to know. This is my daughter's.
Yes.
Nicely labeled.
Yes. And then a thing that I also really, really love, which this one doesn't have, they're still good, but I really recommend the round heads.
Oh.
Yeah.
What's the difference?
So it's like when we polish at the office, like
Yeah.
you just have more like movement with a round brush, like you can really get around.
Versus this is like
Right?
limiting.
It's limiting.
I see what you're saying. And,
Yeah.
and I always feel like this is a little big for her mouth.
Yeah.
right?
Yeah, the smaller the better. The
Okay.
smaller you can reach in better places.
So step one, we need to we're changing this.
I highly,
Yeah.
highly recommend it.
That's really good to know. I had no idea. And I do like that this one has like it automatically shuts off and it kind of
Yes.
has that like, okay, you're done this corner, now go over to this corner and
Yeah,
I mean,
power brushes are the best.
this is the Philips Sonic Care kids brush. We'll mention it. It's fine. We can throw that out there. We can help parents out with all the real tips.
Yep.
And then what about families who maybe don't have access to an electric or just want to make whatever they have on hand work?
Yes, yeah. So for that, what can I use this brush?
Yeah, go for
Okay.
it.
So I'm not going to touch anything, but what you want to do, so this kind of looks like a manual brush. So you want to go in circles on the teeth. And that's like the main thing for kids. You just want to go circles. When you get older, we do different brushing techniques that work a little better.
Okay.
But if you can go in a circular motion while you're brushing.
And then what about like back? Like the front
So
back?
the back, same thing for the kids. If they can, then we want them to do like so say you're doing the bottom teeth
Yeah.
right here. So you want them to swoop up like
Okay.
that.
So almost like they're flicking the...
Yeah, they're flicking it
Oh,
all out.
and so have the Windex and paper towel
Yeah.
on hand, moms who like clean mirrors. So we talked about the brushing. Now let's talk about the daily habits that we could have in terms of what we drink, what we eat, frequency of these things, that could be impacting that like tooth care as well. What are the recommendations there?
I love this question. So to reduce the risk of having cavities, you don't want to be snacking more than 3 hours apart, even drinking juice, all of that, because your teeth are constantly, when you eat a carbohydrate, they get softened from the acid
Okay.
that gets created when you have a carbohydrate.
Okay.
And then when you're not, your saliva helps to do the opposite and it remineralizes your teeth. So it hardens it. So if you at least leave 3 hours for it to harden back, you're way...
So my kid's a snacker.
Yeah.
I have a snacker, an aggressive snacker.
Yeah.
Forget 3 hours, eh? That's, oh man.
So, but there's one food that does not cause the acid attack.
Okay.
And it is old cheddar.
Old cheddar.
Yeah.
Okay.
Like not old, but like, you know, like the old
Yeah,
orange
so
cheddar.
if we're within
Yeah.
that 3 hour window and she really
Have
wants
some cheddar. Yeah. Cheddar
nice.
cheese.
Do you do this with Liz?
Yeah, I do. And
And it
at night
works?
I do it, yeah.
Oh,
Yeah.
good to know.
And I just got her in a big habit of drinking lots of water. So throughout the day, I do not do a lot of juice. That helps. Yeah.
Something we could also work
The juice is so good. Yeah.
You know, we used to do the watered down juice, and then I guess my husband didn't get the memo.
Yeah.
So he started giving the like regular juice,
Yeah.
and when she like had one chance to tell the difference, she's like, "Can Daddy get my juice?"
Kids are so smart.
They just catch on, and
Yeah.
there was no going back. We couldn't water down the juice from there on out.
Yeah.
So my perfect plan wasn't so perfect. And now we have 5 cavities. It's okay.
Yeah.
I'll be okay. Is there any food? So you mentioned the old cheddar as a safe snack option within that 3 hour window. Are there any other foods or things that can help your teeth? Like what's something that...
So,
Okay.
that's a cool question. For some reason, like, we don't have a lot of knowledge as to why, but xylitol, have you heard of, like, the...
I've seen the xylitol gums.
Yeah,
Okay.
xylitol for some reason just does not allow the bacteria to cause an acid attack on your teeth.
Oh.
So, yeah, if, like, you want to, like, have a mint or something, I don't know, yeah.
Like, is there up there? There's xylitol. I know I've seen xylitol gums.
There's mint, there's,
What's something
there's
like
gum.
kid-friendly? Anything?
No.
No?
Honestly, all I can say is, like, stay away from super sticky foods.
Okay.
Yeah.
Like,
Even bananas.
really?
Like, don't stay away forever, but I mean, like, for snacking wise,
Yeah.
stay away from the super sticky stuff and, like, joob, stuff like that. No. Just no.
The candies.
Yeah.
My
Banana-
poor gummy lover. She's gonna be so
No,
sad.
Yeah, just don't even tell her. Just.
No, we don't have them. Sorry, they're not in the house.
Chocolate over gummies.
Really?
Yes. Yeah.
Okay, so she's like the makings of a perfect cavity candidate. No wonder. I'm not surprised at all. So I think what we'll do is probably try and implement like a few things like spacing out the snacking, be more on top of the brushing. A lot of her cavities were in between the teeth, so like introducing more flossing.
Yeah.
And now is flossing something like she can do, or is it something that I need to do?
It's both. Yeah,
Both? Okay.
both. Get the floss picks for
Yes.
kids, right? For
I
adults,
love
I
those.
do not recommend it for adults ever, but for kids, 100%. The ones that are kind of shaped like this and they have the floss
Yeah.
in between, I 100% recommend that.
They're so much easier.
Yeah.
Okay, that's awesome. And it gives them that like little bit of independence. And like my daughter likes the taste of them, so her little tongue is
Aw.
chasing the floss around in her mouth.
That's so cute.
Do you have any other tips or suggestions to help parents to prevent cavities? And
Yes. So,
okay.
the big one, this is the one that I love to tell everybody, is that cavities are contagious. So, yeah. So, there are 3 things that cause cavities, which like nobody knows this. So, a susceptible tooth. So that just means like some people get cavities more than others.
Okay.
The bacteria, Streptococcus mutans. That's the.
I can't say that.
Yeah, no.
Okay.
S mutans. Okay, so that's the one that is contagious and it spreads. And then the other thing is the carbohydrates that we were talking about.
Right.
So that bacteria, it gets transferred from mouth to mouth. So yeah. So
Oh no.
you definitely do not want your kids sharing drinks and stuff. Like if somebody has a cavity, like don't let them share anything because then you can just transfer that cavity over. Yeah.
Really? Even while they have an active cavity?
Mm-hmm. And also say like, so when you're flossing, you always want to move to the next part of floss because you don't want to go into one area, say there was a cavity there, switch it to the next, and then you're just spreading
They're
it over.
contagious?
Yep, they are. Yeah.
I had no idea. So if one kid has a cavity, you don't want them picking up the drink of your other kid.
No.
So you know how you avoid that? You get yourself some labels and you make sure your kid's stuff is all labeled so they don't mix up their stuff.
Yeah.
No germy mix-ups because it's more than just preventing the spread of like viruses, but also
cavities.
cavities. Look at that.
Yeah.
Aren't they great? Last question, which is, how do you encourage your kids to enjoy taking care of their teeth and caring about their teeth?
God.
Which I mean, I don't know. This is
That's
a $1 million question. I
That's
think.
a good question.
But is there anything that you find that helps, gets them excited, gets them interested?
I'm just thinking what I did with my daughter.
Does she take her like mouth care very seriously?
The flavor of like she loves mint for some reason. She loves it. She loves it. So like just to know that she's about to brush her teeth with mint, that's exciting for her. Nice. So you can get a bunch of flavors, right? Strawberry, they're all like taste like gummy bears and stuff like that. So you could do that.
Yeah.
Another thing is that I think kids really like to understand information, which I've realized.
Yeah.
So if you explain like, oh, there's sugar bugs in there and we need to get them out, and they're like, oh yeah, I want to get out the sugar bugs. So I feel like that's a good way to motivate kids to actually want to get in there and do something.
Yeah.
Yeah.
And are there any like resources or places? Are there any good YouTube videos?
Oh yeah. Well, I don't know like exactly, but you can honestly look up just brushing techniques and stuff like that for kids, even like songs to put on while they brush, stuff like that. It's everywhere. The internet has everything.
There's so many resources.
Yeah.
Well, thank you so much. I
Thank
really appreciate all of your tips, and I'll let you know how our next dentist appointment goes once we're done. Guys, 5 separate appointments to get these fillings done. It's just annoying. Also, like
it's a lot to take in.
It's a lot. It's expensive. It's exhausting. It's so many appointments. Who has time for that? Like, this is why it's so important to implement these tips now while you can.
Yes.
And try and prevent being in my shoes. Thanks so much. Yeah. All right. Thanks for watching. Bye, guys.